My interests include working with patients. I just love being with patients. I don't care if it's a young child or an elderly patient. They all have a great story to tell, and if you listen, you'll hear it. My passion is sports medicine. My background is athletic training, and so I do certainly like to work with athletes, but I'm certainly not inclusive of any athlete. My approach to the patient is to first have them come in and get to know them, and more importantly, listen to what they have to say. Following that, I like to do a complete exam and workup, and if we need extra testing, bone scans, CT scans, x-rays, we work with those, and then together we work with getting a treatment plan that works best for the patient depending upon their needs. I will see a multitude of patients, from adolescent patients to elderly patients. I will treat problems that are chronic in origin, and that's usually with our elderly population who have chronic overuse injuries with flat foot, and a lot of times these can be treated conservatively, or at times we work with surgical intervention. With the adolescents, they can come in with juvenile bunions or hammer toe issues. Ingrown nails are very common, and I will treat those as well. As podiatrists, we perform almost any foot and ankle surgery that's out there, that whatever it may be. We perform forefoot surgery in the clinic, include an ingrown nail or a wart procedure. We see a lot of foreign bodies. People step on things. We see those in our practice and care for those right as they walk in. To the more complex surgeries, we do a lot of bunion surgeries. There are outpatient type surgeries, to in-house surgical procedures where we will do reconstruction surgery on some patients who need hospitalization and need a myriad of physicians to care for them as well. I got into podiatry because I was involved in an athletic program in my undergraduate training, and I loved sports medicine, and sports medicine led to concerns I had with my feet while I ran track, and I had overuse injuries, and no one really could help me till I went to a podiatrist, and they helped me out very quickly without any surgical intervention, just working with shoes and good orthotics and proper training habits. And one thing led to another, and I thought I was going to be an athletic trainer and be in education and teach, and subsequently now I teach my patients every day about their problems.
I'm an ophthalmologist here at the Mankato Clinic, and my patient population consists mainly of adults. I have a special focus on glaucoma, but I also see patients for medical retina and cataracts. I have subspecialty training in glaucoma, and so I provide both medical and surgical treatments, which includes multiple options for eye drops, laser procedures, as well as surgical procedures. And there's various surgical procedures, and I try to tailor them to each individual patient. I was fortunate enough to have received the training at a very well-known eye center. It's at the University of Miami Bascom Palmer Eye Institute, where I got to work with some of the world experts in treating glaucoma. It was a fabulous experience, and I learned so much and saw so many complicated cases every day, and that really helped prepare me for my practice today. And in that, I feel comfortable dealing with really any type of problem with glaucoma that comes through the front door. I think I enjoy the clinical as well as the surgical aspects of medicine, and ophthalmology is a perfect blend of each of those. I also enjoy seeing patients on a regular basis, and that's something that I do frequently with my glaucoma patient population. I also get the opportunity to take advantage of all the newest technology that's come out recently, and ophthalmology is a field that's been constantly evolving, and thankfully we've had a lot of advances that help us to recognize and treat diseases sooner and more effectively. My patient population is fairly diverse in terms of where they come from. We do have a number of patients that come from the local community, but as far away as maybe 100 miles away, because I'm the only glaucoma specialist in the area. The next ones would be in like the Rochester or Twin Cities area. So I do get a lot of patients that travel a fairly significant distance in order to see me.
I grew up in Nigeria, which is a country in West Africa, and got my medical degree in Nigeria. I got into medicine because I've had interest in health since I was a little girl. And I remembered I had an aunt or a cousin that was a nurse, and I used to really admire her a lot. And I thought I would always be a nurse. And I could have been very happy doing that too, but somehow I ended up in medicine. Yeah, in family practice, we pretty much do everything from birth to end of life. So I have had the opportunity to take care of all, from newborn to take care of people at the end of their lives, and it's been very exciting. Right now, my practice is mostly women, and mostly women in the middle ages, because I do not do obstetrics. I don't have a whole lot of pregnant women, nor a whole lot of children in my practice, but I do have probably about up to 5% of my practice may be pediatrics. Majority of my practice is tending towards the middle-aged geriatrics. People will come to me and talk to me about their health. If I'm just walking down the street, nobody would do that. And on account of the fact that I have been blessed to carry that MD degree, I think it's a privilege that when I see people, I see them that this person feels that I can be here to help them. Therefore, I want to see them as a whole. So, I try to get to know people. I'm pretty social, I think. So I try to get to know people, and I try to create an environment that makes people comfortable so that they don't feel so tense. Coming to doctor's office for some people is very tough. And once I see that people are comfortable, then I try to get into the reasons why they're there. So my whole approach basically is holistic. I try as much as possible to look at the whole person, not just their disease condition. I've learned a lot, over the last several years. And my goal is to keep learning more and more how to help people. And I do enjoy looking into not only caring for patients, but contributing in ways in which I can provide some leadership, not only to the clinic, but in the community. Because caring for people will also need to be able to know what is happening around us and bringing it all into perspective. Medicine is changing a lot. It's not just the human being doesn't change. Your physiology doesn't change, but the factors that contribute to practicing medicine change. So we need to keep abreast with both the knowledge of medicine and the politics of medicine.
My practice at the Mankato Clinic really spans the entire reproductive life of women's care, from early teenagehood, even sometimes younger, even pediatrics, into the mature woman's health care. So I see young women, I see reproductive age women, I see older women. I take care of multiple different medical problems that all women experience, including pregnancy and beyond. My OB practice is busy. It's at least half, probably more like 70–80% of my practice here at the clinic. Because I'm a relatively new provider to the clinic, I think most of the women I see are first-time pregnancy patients, but I'm also beginning, now that I've been here for a few years, I'm also beginning to see the recurrent patients, which is really fun. I see all ages of reproductive age women. I see young teenage girls who are pregnant, and I see more seasoned mothers as well. And I take care of not only singleton babies, but I also take care of multiples and high-risk pregnancies, gestational diabetes, hypertension, other thyroid diseases and other medical problems that occur in pregnancy as well. For surgeries, I'm interested in all, and I perform pretty much all the standard gynecological surgeries that are out there. I have a couple specialized areas that I am technically proficient at, including laparoscopic hysterectomy and other minimally invasive procedures, sterilization procedure called E-Sure that can be done in the office, which is a new thing here that I brought to the Mankato Clinic. And then also urology, a type of urology treatment called suburethral slings that are for incontinence and women who have problems with urinary leakage and things. But I also perform C-sections and hysterectomies and other various surgeries that women may need throughout their life. Well, I'm from South Dakota. I grew up on a ranch. My parents are ranchers and continue to do that. So I've always been interested in a primary care type of setting because I came from a very rural area with minimal physician access. And when I was in training in medical school at the University of South Dakota, then I became very interested. I found out that I was really more interested in women's health care. And that's what drove me into obstetrics and gynecology. I was also very interested in surgery, and obstetrics and gynecology is just a lovely meld of primary care and surgery all in this sort of its own subspecialty. You get to see women throughout their lifetime. You get to be part of joyous moments in their life. And generally, women in these times are all very well. So it's really a pleasant experience throughout the entire care process.
The most important thing for me in practicing medicine is making sure that the patient is treated well. And the main goal is to direct the different treatments that we have to fit the patient and their needs. My practice at the Mankato Clinic is varied. I see patients from infancy up into adulthood. I enjoy seeing an athletic patient population and also seeing patients who are more elderly. So my patients come really from every walk of life and have a variety of activities. My approach to caring for patients is really quite simple. I take each patient and take their needs and their problem, and we balance the possible solutions with those two things. Some people are able to get better with a pretty simple correction or a pretty simple treatment, and some people have a similar problem but require a very different solution. And so I don't have a cookie cutter way of practice, but I treat each patient as a specific set of conditions and problems and then work with them to try to get them better. My clinical interest involves the entire foot and ankle. I am experienced and I have extensive training in forefoot and rear foot and ankle problems. I treat those conservatively with orthotics or bracing, and sometimes we have to go on to surgical correction. Many times those complex surgical corrections are done in an outpatient basis, and sometimes they have to be done in the hospital with an inpatient procedure. So my experience and extensive training enables me to treat the whole foot, ankle, and the entire complex. I chose foot and ankle surgery and podiatry as a specialty because this is a way that I can help to get people better. A lot of people have problems with their feet, and there are many ways to treat them. I get a lot of professional satisfaction from seeing people get better and getting back to the activities that they want to do.
My practice at the Mankato Allergy Clinic involves evaluation and treatment of a variety of allergic disorders, which can include allergic rhinitis, or nasal allergies as they're commonly known, as well as asthma, even food allergies, and some skin conditions such as atopic dermatitis, which is frequently known as eczema, as well as hives and even contact dermatitis. For example, those that react to something like nickel may experience a rash when they're in contact with it. The ability to connect with patients from a professional level, especially being able to empathize with them because I have allergies myself, and growing up, a lot of my friends had asthma. My approach to caring for patients involves, first of all, establishing rapport, having a tone of friendliness as well as compassion and empathy, and also obtaining an adequately thorough clinical history, because that is important in determining a proper diagnostic and therapeutic approach, as well as educating them such that they feel like they have a greater understanding of what they came in for compared to before they came for the visit, in a language that they easily understand. The procedures that are commonly performed in the allergy clinic include allergy testing, which most commonly involves skin testing for allergens such as pollens, dust mites, animal dander, molds, collectively known as inhalant allergens or aeroallergens. In some cases, if the clinical history raises suspicion, we may test for foods in a similar manner. And we also do lung function tests, which are called spirometry for those who have asthma. And in some cases, we've even done in-office oral challenges to a food to see if a patient can safely eat the food, and that essentially involves having them consume a small amount of the food and observing over time as they consume gradually increasing amounts to see if there is any reaction, which of course if there is, we are readily available to treat.
My practice at the Mankato Clinic as an obstetrician gynecologist involves seeing obstetrical patients throughout their antepartum care and throughout their delivery and through their postpartum care. So during those 9 months I get to see and know those patients, and also often get to see and know their families, and get to see their excitement and get to see their joy and anticipation, and I guess that arguably makes my job one of the best jobs anyone could ever ask for. We do many types of minor surgical procedures as outpatients. We do DNCs and sterilization procedures, and we do now a lot of what we call endometrial ablations for bleeding problems that used to result in hysterectomies. So all those are outpatient procedures that we very commonly do now. We still also do major GYN procedures for larger tumors or pelvic masses involving what we call laparotomy incision, a large incision, but also now we do a fair amount of what we call minimally invasive surgery, where we're, instead of a large incision, we're operating through incisions that are a few millimeters with specialized telescopes and instruments, so we can do hysterectomies through very small incisions. Then we also still do, vaginal surgery is still one of the best surgeries we can do and the least invasive surgeries we can do, where there's absolutely no incisions in the abdomen. And then we do C-sections, and about 30% of deliveries in the United States now are done by cesarean section. So I think our numbers are a little less than that, which I think is good, but we do a fair number of cesarean sections now. Well, I think part of the reason I became an obstetrician is because there's a wide variety of activity. I'm in the office and in the delivery room and in the surgery suite, and also because obstetrics and gynecology has always been a leader in preventative care, and I have a strong interest in preventative care. Nothing makes my day more than to see a patient come in who I've talked to, and she's lost 25, 50, 100, 150 pounds, and her blood pressure's down, and her blood sugar's down, and her cholesterol's down, and her arthritis is better, and maybe her depression and anxiety is better. And I know that makes my day, because I know that patient has dramatically changed her life around, that she's prevented, more likely than not, numerous health problems, more likely than not added years to her life and added quality to her life. So with the statistics out about the benefits of preventative medicine, I think that's really one of the most exciting areas of our profession right now.
It is very rewarding professionally, and every day is a puzzle. A patient comes for preventative care or diagnostic care. They're looking for an answer. And sometimes we do some therapeutic treatments as well. So the goal each day is to be accurate and collaborative and comprehensive in evaluating a patient's problem. Using imaging, we are often able to give them some answers so that they can direct their health care. So it's very stimulating, very real-time, and with the electronic medical records, it is just an infusion of information, and hopefully at the end of the assessment, we're able to distill the answer and get them the information that they need. Our predominant interaction is with the provider, the doctor or nurse practitioner who saw the patient, had a question, and sent them for imaging. So it is almost more of a professional collegial dialogue all day that we partake in. And through imaging, even though we as the radiologists might not directly see the patient, we are on a dedicated hunt for an answer in whatever imaging modality they had. The multi-specialty aspect of the clinic was very attractive to me because it allows each group of professionals to stay focused in their area and develop that to its highest potential as we all search for answers and more direct preventative care for patient health. So just the community dedication, the collaborative effort, the multi-specialty aspect, and as an imager, the state-of-the-art equipment. It's very rewarding professionally to be able to use that to direct patient care. I was interested in medicine from an early age as an offshoot of the biological sciences, and it seemed a natural progression. So I just had a passion for it and studied, and I enjoyed it, and it just always seemed to fit. So I don't remember any single one moment that it just seemed always a place that I would go. And when I got involved with medicine and the training, and it was just very comfortable for me, and it's been very fulfilling every step along the way.
I was born in Bloomington, Minnesota, and grew up there. Then I went to the University of St. Thomas, which used to be the College of St. Thomas when I went there for my undergraduate, and then went on to the University of Minnesota for my medical degree. I had an Air Force scholarship, and so then I went into the Air Force and did my first year training at Andrews Air Force Base in Washington, D.C., where I met my beautiful wife. And then I was transferred to Ellsworth Air Force Base in Rapid City. And then I went back and finished my residency in family practice in Delaware for 2 more years, so it's a 3-year residency total. And then after that, I've been here for about 16 years now, enjoying Mankato quite a bit. Well, I do general family practice, which means I do everything from actually pre-birth to death and anything in between. My favorite part of the job by far is doing obstetrics and delivering babies and taking care of the newborn babies and young children. It's just the funnest part of the job by far. People are excited. Yesterday I had a lady came in who's having their first pregnancy, and when we heard their baby, she was crying, and I mean, it just brings a ton of joy to you to see that excitement and that enthusiasm with expectant moms and dads too. They're both pretty excited, and that was really fun. And then of course being there when they deliver their baby, it's such a joyful time. Then, of course, after the babies are born and people bring their babies to me, and it's great to see them grow. Right now, from the oldest first baby I've delivered is now 15 years old, and so he's in high school, and it's just neat to see these kids grow up and see them develop, and that's by far my favorite part of the practice. My hope and goal is that someday is to deliver a baby from somebody that I delivered, and we'll see if that works out in the end. But I love seeing all the generations. I probably have 10, 15 families that I have 4 different generations of family, and that's the neatest thing, because you really get to know them. you know the family structure, you know some of the stressors that are on them. That makes it, I think, hopefully, me a better doctor for them, and them getting better care in the long run, which is the most important thing. Well, one of my biggest approaches, of course, is we want to do what's best for the patient. We want to do what's most recent with the research and things like that, so what we call best practices. But I also think that sometimes things are overdone, meaning there's sometimes too many tests and too many medicines and too many things where sometimes the results aren't best with medicines, it's with changing your lifestyle. You know, in family practice, we certainly do a lot of preventive well child exams. We do a lot of preventive adult examinations to try and find that you have high cholesterol or diabetes early, because if we control them at that stage, you're not going to get the significant complications of strokes or kidney disease and things like that. And so if we can think ahead of the curve, it makes it a lot better. You know, a lot of times people are at 40 and they're a little overweight and they say, oh, I'm just having a terrible time losing weight. I say, well, if you get to be 55 and you're overweight and you get diabetes or high cholesterol, the first thing I'm going to tell you is to lose weight. So if you lose it at 40, it's going to be a lot harder to lose it at 55 than it is at 40. So we try and think of these things ahead of time and again, head them off at the pass and prevent these problems from occurring. Healthy, happy patients. And sometimes they're happy and they aren't healthy. And all I can do is encourage them to take those steps. But I enjoy seeing different age groups in my practice because they all have their different challenges and they all have their different rewards, for me particularly. But I do like to be mentally challenged, to care for people at different age groups because they have the different diseases and different disease processes. Ultimately, one of the most successful things is when I have patients go out and another patient comes in and says, oh, Mrs. Johnson told me you were the best doctor, so I wanted to come see you. And that's, a great compliment to me, and I have a wonderful nursing staff, and my patients tell me, boy, your nurse is such a great nurse, and that makes me feel great. In our family practice group in Mankato, especially Mankato Clinic, and especially in the Wickersham, we have such a wonderful team there that makes it easy. If I'm gone, I know if someone comes in sick, one of the other docs or my physician's assistant Heidi is going to take great care of them, and they don't have to worry about it. And I know that they're going to get good care wherever they go in our clinic, but certainly whenever they're at Wickersham. And I think our patients feel the same way.